Hi, my name is Dr. Lynne Aitkenhead. I'm a clinical psychologist and I work with adults who have inherited metabolic disorders, including PKU. This is the first webinar that I've done and I'm really excited to be able to speak to you in this way. So thank you very much for signing in. Please do send some questions, use the Q&A function and I'll be answering your questions after I've spoken for a bit at the start. I just wanted to say a couple of extra things. The first is just a reminder that this webinar is for people who have PKU or carers of people who have PKU from the UK and Ireland. And the second thing is that nothing I'm going to say today is intended to replace advice that's tailored for you from a healthcare professional who knows you. But I hope that I will just give you some interesting extra ideas and things to think about. The topic for today is making positive changes. So the reason I'm talking about that is because we know that living with a long-term condition can mean dealing with some extra challenges and some extra stresses, whether they're symptoms related to the condition or things to do with managing the condition. For example, in PKU, might be managing the diet, might be managing hospital appointments or tests that you need to have. It might be dealing with other people's reactions to living with PKU and some of the things they believe about it, rightly or wrongly. And just as much, stressful events that happen in life, as they do, can affect how well you're able to manage PKU. So for example, managing the diet. I'm going to talk about some tips and ideas that can help you to take effective action when you're faced with challenges and stresses and things that trigger difficult feelings like anxiety. So I'm going to start by saying a little bit about those difficult feelings. The human mind has evolved over the last tens of thousands of years, and it's evolved with one main, most important purpose, which is to keep us alive. And in order to do a really good job at that, it has to be really, really good at picking up any kind of threat in our environment and alerting us to it straight away. So our minds are always looking around us and throwing up these worries. What if that bad thing that happened before happens again? What if this happens tomorrow? Humans are social animals, so a lot of those threats are about what might happen if we're rejected by our social group, because tens of thousands of years ago, somebody on their own might not have lasted very long. So that's a very real threat. So some of those worries are comparing us to the people around us. How do we measure up? How do we fit in? Are we contributing enough? Are we doing well enough? In modern day life, that's not always quite as useful. And in fact, it can be quite tricky to manage. So I'm going to talk about a few of the things you can do to take back some control. A few good questions to ask yourself about the things you're doing already to try to manage those difficult feelings. Are some of them actually keeping the feeling going? And the classic example here is avoiding the thing that triggers the feeling. So for example, avoiding something that makes you feel afraid so that you don't have to have that horrible scared feeling. And that's a normal, understandable reaction. It is the way we've evolved. If you reach out your hand and touch something hot that burns, you're instantly going to pull your hand away to stop that feeling straight away. And if something makes you feel sad or ashamed or angry, you're going to want to avoid that thing. But some of the time that can keep us stuck in kind of a trap because we miss out on the opportunity to learn whether our fear was realistic, was justified, whether we should be as worried as we were by that thing. And perhaps we also miss out on some opportunities to broaden our experience, make our experience richer, try some new things and challenge ourselves. What do the coping strategies that you use at the moment cost in terms of energy or relationships? And some examples here might be things like when you feel a really difficult feeling, when you're feeling really stressed or really tired, having a glass of wine, having a bar of chocolate. Those things can suppress that negative feeling and they're okay to do from time to time. But it's when we use those strategies too much that they become a problem. And are you actually doing the things that will help take you towards your goal? So what should your goals be in the first place? Well, I always suggest, first of all, that when people are setting goals for themselves, they start by spending some time thinking about what their values are and really getting in touch with what's important to them deep down. So values are different from goals. Goals are something that you can meet or achieve, or equally you can fail at. You could have a goal to get married and you could achieve that goal and tick it off and be done. But if your value is to have a loving, supportive relationship, that's not something you can ever say, there, that's done now, I'm going to stop working at it. It's got to be something you're always striving for. It's the direction you travel in rather than the destination. And acting in line with our values tends to just inherently be more satisfying and more fulfilling, but it also tends to be a bit more challenging, harder work, and quite often involves facing up to some of the things that make us feel nervous or unsure of ourselves. So there's a few questions here, some ideas that you could ask yourself to help you learn what your values are. What do I want my life to be about? What sort of person do I want to be? What sort of person do I want others to think of me as? What sort of relationships do I want to have in my life? How do I want to spend the time and energy that I have? Some kind of examples of values people often talk to me about might be being a good parent, being a good son or daughter, being a supportive friend, contributing to your community, succeeding in your career, perhaps always learning and developing throughout your life. So step number one is to perhaps get in touch with those values, and then they'll indicate the kind of goals that might be important to you. Once you've got a goal or some ideas, it's important to make sure they're realistic. So just check in with the expectations that you have for yourself and make sure they are reasonable. A lot of us tend to perhaps set quite high standards for ourselves. But what we want is for you to have some goals that you can achieve and get a real sense of satisfaction and progress from. Make them specific. At work, you might have heard about SMART goals. So specifying what you want to do and how often is really important. So for example, saying, I want to go swimming twice a week for half an hour each time, or I want to have coffee with a friend once a week for an hour, might be good examples of specific goals. Breaking the goal down is really useful as well, because it's easy for a quite big, distant goal to feel really overwhelming. But if you break it down, it helps to really make it clear what you need to do in the here and now to take you towards your goal. And it also helps you to notice the progress that you've made. We all tend to compare where we want to be in life with where we are right now, and not where we were yesterday or a week ago or a month ago when perhaps we started working towards this goal. So it can be really motivating to see the steps decrease that you need to make before you reach your goal. Keeping track of your progress is useful for the same reason. It helps you stay motivated and it helps you give yourself credit for the things you've already achieved. I really like visual ways of keeping track of your progress, and there are a whole lot of apps and websites that can do that for you, especially if your goal is around something like fitness or weight management. There are all sorts of special things already out there that can give you fancy statistics and charts and graphs, but you could use anything. You could make something of your own that's a chart or a tick list or a diary. You could keep it on your smartphone, you could stick it on the back of a door. I think the important thing is that it lets you see how far you've come, and it lets you reward yourself for the things that you have achieved, whether that's by a more material reward or by just sort of giving yourself well done and some acknowledgement. I'm going to talk a bit about planning for setbacks. I know that might sound a bit negative, but in real life, progress doesn't tend to be straightforward and travel in a nice straight line like the chart on the left there. It tends to be a bit more like the chart on the right, in that things take a bit of a wigglier path to where we want them to be. So it's really helpful to spend some time sitting down and really thinking about what will help you to keep on track if things do take a step backwards or not in the direction that you'd like. And how can you do that? Well, you could start with these questions, asking yourself, in the past, what's tended to work well for you and what's tended to not work so well. Trying to get familiar with the things that can trigger a bit of a setback for you, and they might be external things like particular situations or challenges. They might be internal things like particular thoughts or patterns of thinking, particular feelings, particular things that you do. And it's useful to think in advance about what you could do to help at those times. If things go off track, what could help you? Are there any resources you could use? And when a setback does happen, it's actually a really useful learning opportunity. So it's worthwhile setting aside some time then to really reflect and think about why things didn't go to plan and what you might like to do differently next time. There are a lot of formal frameworks to help you with this problem-solving process that you can find online or in self-help books. There's an example here. And these can be helpful because they can really clarify your thinking and make sure you're not missing anything out. So for example, if you were to use this framework, you might spend some time clarifying exactly what the problem is that you're facing, writing down what all of the possible solutions are. And this is a stage where it's helpful to enlist someone else's help if you can, who can help you think of some extra solutions that might not have occurred to you. Writing down the pros and cons of each. I know it sounds like a lot of work, but it can help to make things really a lot clearer. Once you've written out the pros and cons, they should help you decide which is the best solution so that you can break it down into steps, just like I spoke about. Start with the first one and work up. And then as you go, be evaluating what you're doing, be checking that it's working, making adjustments if you need to, and learning for the next thing that you try what it is that works well for you, what you'd like to do again, and what you'd like to change a little bit. So I mentioned there asking other people for help, and I've got a slide about that here because for a lot of people that's actually a really difficult thing to do. It might sound straightforward and there might be all kinds of useful help out there, whether it's emotional help, whether it's kind of practical help with things around the house or things at work, or whether it's information and advice that you could get. And it might be advice from your family, might be help from your friends, it might be from a healthcare professional. But for a lot of people, it is a really challenging thing to do. And I think there are a lot of different reasons why that is, depending on each person's experiences they've had in their life so far, depending on their beliefs about themselves and other people and the world, and depending what their values are. A lot of people tell me that they worry that other people will be annoyed if they ask them for help, that they might think they're being lazy, they might feel quite guilty about it. A lot of people tell me that they worry that if they talk to other people about their problems, they'll be burdening them somehow, and it will have a negative effect for the person they talk to. Whereas, interestingly, when I ask people who have been asked for help, they quite often say that they felt quite pleased to have been asked. They perhaps felt valued by that person. They perhaps felt closer and more connected to them. So it might be useful to think about what's getting in the way if you find it hard to ask other people for help. You know, a lot of people perhaps feel like they need to push themselves to cope on their own and stand on their own 2 feet. So it can be a really challenging thing to do. Think about changes you could make, and probably it's easiest to start small by just asking somebody who's easy to approach for something small initially and seeing what that feels like. And it's really important for all of us to do this, to take care of ourselves and ask for help when we need it. People who have a lot of responsibilities taking care for other people often say they find that hard. Parents really naturally want to do everything they can for their children. They want the best for them. And I always tell them the same analogy. When you take a flight, they give you a safety warning at the start, and they always say that if the cabin pressure drops, then some oxygen masks will fall out from the ceiling. And they usually say if you're traveling with a small child that you should put your own mask on before helping them. And we all understand why they say that, because how can you help somebody else if you haven't taken care of yourself to start with? And I think it's just the same for parents and anyone else who's caring for someone, that taking care of yourself is actually a really critical part of being able to do that. And some of the time that means being able to say no. And for a lot of us, that's a challenge as well. So I wanted to say a bit about assertiveness. By assertiveness, I mean this middle ground in between being passive and kind of saying, oh, okay, whatever you say, we'll do it all your way, and being aggressive and saying, no, look, we're doing it my way. It's my way or the highway. This is how it's going to be. Being assertive means being able to communicate with people clearly and directly and appropriately what you need, but at the same time taking into account their feelings too. So we all tend to make assumptions about what other people are thinking about us and about what they'll read between the lines from what we say. But it's really easy then to get caught in a bit of a misunderstanding where we're reacting to what we think they think, and they're reacting to what they think we think they think. If you can say something clearly, it tends to be much easier for other people to know how to help you. It's the difference between saying, oh, would someone for once please just finally take the bins out, and saying, could you take the bins out now, please? So some good things to help you cultivate this skill, I think, are practice. Practice makes perfect. And for most of us, it's always a work in progress, getting the balance right. Again, starting easy. So start with somebody who it's easy to talk to in an assertive way and work up. And practicing that reflection skill, looking back on circumstances where you would have liked to be more assertive and perhaps it didn't go how you wanted, and thinking about what you might do differently next time. So a few sort of examples, like for example, if you were in a consultation with a doctor and you wanted to ask something and they said, oh, actually, you know, we're near the end of our time. Perhaps there are some assertive ways of handling that. You could say, well, how long do we have left? You could say, this is worrying me a bit, so I would like to talk about it for the last 5 minutes. Or you could say, could we make another appointment when we could talk about this problem? If you were planning something with friends, you might need to say, oh, sure, I'll eat out with you, but could we choose a restaurant where the menu's online so I can check that there's an option that's appropriate for me? So you've taken into account the other people's needs, but you've also said what it is that you need really clearly. So in a few of the earlier slides, I've touched on some thoughts that can sometimes be unhelpful or get in the way of us doing what we want to do. But what are thoughts? It might not be something you've thought about before, but thoughts are mental events. Our minds are always trying to make sense of the world, so they're always throwing up thoughts all of the time, usually bubbling along just below our level of awareness. So we call those automatic thoughts. And we tend to assume that they're true and to feel as if they're true and act as if they're true. But our mind doesn't always get it right. And it can sometimes be biased in particular ways. So those thoughts might not always be 100% realistic or 100% balanced. They might not really reflect the world out there. If you practice, you can learn to tune into those thoughts and become more aware of them. And there are a few things that sometimes, if you notice a particular thought that's unhelpful, some questions that might be useful to ask yourself, like, for example, am I making sure I'm noticing both the positive and the negative aspects of this situation? Am I seeing the picture in black and white? Not many things in life tend to be absolute. Not many things are always true or never true or 100%. There are a lot of grey areas. So for me, that's always a warning sign that a thought might not be completely accurate, and it's worth checking. Am I expecting the worst? Am I jumping to the worst possible case scenario? Is this something I'm totally responsible for? Am I being fair to myself and setting realistic expectations for myself? And my personal favourite, if a friend was in the same situation, what would I say to them? Because sometimes it's really surprising how different the words you would have for somebody else that you care about are different for the ones you'd have for yourself. So I wanted to talk about a bit of a metaphor, a bit of a way of thinking about some of these internal experiences that we have popping up all of the time. I want you to imagine that you're a bus driver driving your own bus on your own journey towards whatever goals you might have. You're the driver, which means that you have the say over the direction the bus takes and the speed it travels. But there are also a bunch of passengers on board the bus. And those passengers are all different internal experiences. So some of them might be thoughts, some of them might be memories of things that happened in the past, some of them might be emotions, some of them might be things to do with PKU. So they might be perhaps tiredness, they might be some difficulty concentrating. For some people, they might be feeling stressed or feeling worried. They might be memories about what living with PKU was like at different times, say when you were much younger. So we all have our own individual set of passengers along with us for the journey. And these passengers all want to go to their own particular destination. They don't necessarily want to go where the driver wants to go. And they're probably going to try to persuade the driver to go where they want. So there might be a passenger on there, a low self-esteem passenger that says, don't try going that way because you'll fail anyway. You know, don't try applying for that new job. Don't try that new project. You'll never succeed at it anyway. There might be a passenger who says, you have to go down this road that you go down all the time. You have to stay late at work every night, and you have to always prioritize work over the other things in your life. And the passengers might want to convince you, you need to go where they say. They might get right up to the front of the driver's seat and be shouting really loud. And that might bring up all sorts of feelings. It might make you feel sad, scared, afraid, nervous, shy, guilty, all sorts of feelings. Much easier if the passengers were to sit at the back and just be quiet. So you might try and sort of cut a deal with them and say, okay, I won't go to the places I want to go if you just stay at the back and stay quiet. Now I'll just keep going down the same roads I've been before, and everybody sort of feels better. Probably your passengers aren't getting triggered to get really noisy, and you're not experiencing some of those difficult feelings that they bring up for you. But you're also not traveling in the direction you really want to travel, probably not living in line with your values or achieving your goals. So there's a definite downside to making that deal with your passengers. I wanted to talk about a way of experiencing, I guess, those events that might be memories or feelings or thoughts, called mindfulness. You've probably heard about it already. It's a bit of a buzzword at the moment. So mindfulness is paying attention to the present moment, not jumping ahead to what might happen tomorrow or what you're going to have for dinner, and not thinking back on what happened earlier when you did the wrong thing or said the wrong thing. It's also paying attention non-judgmentally, so not getting caught up in whether you should be having that thought or experience or what it means about you or about someone else, but just accepting the experience for what it is and noticing it. And it's been shown to help some people to cope with physical health problems and with the stresses and feelings that come with them. And it's really hard to sort of explain exactly how it helps, probably in lots of different ways, but some of the things that it can help with are letting you appreciate and experience positive experiences more, letting you experience the negative things in a way that they feel manageable, and in a way that they naturally come and go, just like they do for all of us. And to help you become aware of impulses to respond to those feelings in a particular way, so that once you're aware of them, it can open up some choices about the way you want to respond. Another important and related idea is self-compassion, so the idea of treating yourself with kindness. I think this is really important because I think in society at the moment, we all get taught from an early age to be kind to other people. We get encouraged to be respectful to our elders, to help our teacher, to share, to be kind. And it's not often that anybody takes the time to really teach us how to be kind to ourselves. So I wanted you to just try a bit of a thought experiment with me, if you feel comfortable to try it. I want you to imagine if the critical voice, the voice in your mind that tells you when you haven't done something well enough, when you haven't met your own standards for how well you think you should do at something, what would it be like if I could just take that voice away, if it just disappeared right now? Is there anything that you would be afraid of if that voice were to disappear? What do you think might happen? And I would guess that some of you would worry about whether you would achieve the things you want to achieve. Some of you might worry about how that would affect your relationships if there was no voice inside your mind saying, oh, you're hogging the conversation too much, you'll upset them if you do that, you shouldn't have said that. I want you to imagine as well what might be better, whether anything would feel easier. I want you to try, I know it's a strange thing to ask you to do, to imagine that voice as something separate from you and outside yourself. So can you imagine it as either, could be anything, it could be a person, it could be a cartoon, an animal, an object, it could be something real or something not real, it could be a person that you know. But see if there is an image that you can bring to mind of that voice that tells you off when you feel that you haven't been good enough. And just spend some time thinking about what it looks like and also what it sounds like. Is it loud or is it quiet? What qualities does its voice have? Is it shrill? Is it low pitched? And once you've got an idea in your mind of how that voice looks and how it sounds, I want you to ask yourself, would you want that voice to be a teacher for your children or for somebody that you care or love? Would you want them to have that voice trying to teach them and get them where they want to go? Because I know the kind of teachers I think are most effective are probably the ones that are warm and encouraging rather than ones that are harsh and critical. So how can you learn to be more kind to yourself? There's some information here from a psychologist called Kristen Neff. So she says, instead of mercilessly judging and criticizing yourself for various inadequacies or shortcomings, self-compassion means you're kind and understanding when confronted with personal failings. After all, whoever said you were supposed to be perfect? You may try to change in ways that allow you to be more healthy and happy, but this is done because you care about yourself, not because you're worthless or unacceptable as you are. And she talks about 3 elements to being kind to yourself. So the first is self-kindness as opposed to self-judgment. It's treating yourself with understanding and with warmth when you don't manage to live up to the standards you've set for yourself, or when you feel like something's gone wrong. common humanity as opposed to isolation. So it means recognizing both making mistakes and shortcomings and suffering and negative, painful feelings as part of the human experience that we all share, something that affects everybody. And mindfulness, which we've already talked about, but that's mindfulness as opposed to over-identification. So allowing yourself to feel the negative feelings without trying to deny them, without trying to reject them, but at the same time not feeling caught up in them, fighting them and trying to get rid of them, or being swept away by them. So there's a whole range of places where you can find out more information about the ideas I've talked about. If you want to find out more about accessing talking therapy with a psychologist or another kind of therapist, try typing, "Can I get free therapy or counselling?" in the search engine online. And you should be able to find out about what's available in your area. There are some really great support groups and organisations out there that could also help you, and there are some specifically around living with invisible conditions or living with PKU. There are some self-help resources, some electronic ones and some books, and I've mentioned a few here. So the Overcoming series of books covers a whole range of topics. There's, for example, overcoming depression, overcoming anxiety, overcoming panic, and they are based on a kind of therapy called cognitive behavior therapy, with self-help programs that you can learn about those difficulties and learn about ways to manage them. There's a website called Mood Gym there, which also is a website for teaching cognitive behavioral strategies. If you're interested to learn more about mindfulness, I've recommended an introductory book here called Mindfulness, A Practical Guide to Finding Peace in a Frantic World. They have a website as well called Frantic World that has a number of guided meditations and information you can access. There are also online mindfulness exercises through an app called Headspace, and you can find out more about self-compassion and different kinds of exercises for cultivating and practicing self-compassion skills on this selfcompassion.org website. I've talked about some ideas that come from a kind of psychological therapy called acceptance and commitment therapy. So if things like the passengers on the bus metaphor and the idea of being mindful of negative feelings particularly struck a chord with you, you might be interested to read these books, The Happiness Trap or The Reality Slap by Russ Harris. And there are also some online videos from the same author that you can find giving summaries of some of the ideas in the books. So I hope that you might want to just learn a bit more about the things I've talked about today. And I hope I've sparked some curiosity and plenty of questions. I'm going to hand over to you at this point, and I think we've had lots of questions submitted. So the first question: I have 2 children who are 4 and 1, and I also work part-time, so I'm so busy. I find it hard to keep up the motivation to stay on diet. Any tips? Also, how to balance the diet with losing weight. I want to be healthy, but mealtimes take so much brain power from a tired mummy when I need to balance low-protein diet with a low-calorie diet, and I often end up cheating both. So the first thing that I want to say in response to that question is I'm not a dietitian, so I can't give you specific advice about managing both of those types of diet. So I would suggest that you do talk to your dietitians at your metabolic centre for some ideas from them and information. But I also really want to say well done on everything you're already doing. I think that looking after 2 children and juggling a job is no mean feat. So I hope that you're able to be quite kind to yourself when you're not able to live up to all of the things you'd like to be doing. I'd also come back to some of the ideas from the presentation. So make sure that the goals you're setting are realistic and achievable for you, and sustainable goals that you can keep going even when things get busy and get tough. Make sure you take time to notice the things you have achieved and give yourself that recognition. And try to be kind to yourself when you're feeling that feeling like, oh, I've cheated. You know, what will help you? Will feeling guilty and beating yourself up help you, or is there an alternative to that? No, I think that like I said, most parents struggle with the idea of making time to take care of yourself. It is an essential part of being a good mum or dad. So it also sort of, I'm also wondering about whether prioritizing some time to manage your diet and do the things you want to do for you, I wonder how that might affect things. It might mean being assertive and saying no to some things at home. It might mean asking for more help around the house. But I wonder what impact it would have on your feelings about managing PKU and managing weight management plan. I'd just be curious about that. So next question. I'm trying to make a healthy and low protein diet for my life day to day at work, but often finding food that's healthy and low protein and meal worthy can be difficult. Any suggestions? That's a really tricky one for me to answer as well. I think I'd have to say that it would probably be helpful to talk to your dietitian again at your metabolic centre about that one, because I'm not a dietitian, so it's really hard for me to suggest specific plans or specific foods and ideas to try. If you know your levels are high and you're not enjoying life at the moment, for example, experiencing symptoms of anxiety, depression, or low mood, are there simple first steps that can help? So I think as a first step, I'd suggest that you discuss the difficulties you're having with your GP, because they'll know all of the different options that are available to help you, and they'll know how to access those different options. So they'll know, for example, if you need to talk to somebody else, or they'll know if there's somebody near to where you live that could help you. Everybody with PKU should be under the care of a specialist metabolic centre, so you might want to discuss those kind of problems with your team there as well at your next appointment. I think my main advice is to use the help that is available and to get some advice about the things that might support you. The next question we have: how to deal with persistent noise from my neighbour in my block causing me unnecessary sleepless nights. This is making me angry and exhausted, and I'd like to know, are there any ways of promoting sleep around this problem? That's a really tough question. It's really hard for me to know what is the best thing to do in that situation. I can suggest a few ideas or things to think about. I guess there are two kind of types of ideas to think along. The first is external things that you could do. Is there anything you could do, for example, using assertiveness skills that I've spoken about, to talk with your neighbour to see whether they can keep the noise down? Or is there anybody that you could talk to who could help you to manage the noise problem, for example, the local council? Or could you change the environment by doing something like using earplugs to try to reduce the noise when you want to sleep? If you can't change the environment, I guess there are some internal strategies you could think about. So you could think about maybe some sleep hygiene tips to try to maximize the quality of your sleep generally. And you can find those, again, by searching online, but they're things like trying to follow a regular routine, to get yourself into the habit of falling asleep at a particular time and getting up at a particular time, and also follow a routine before you go to bed to help your mind get in that state that's ready for sleep. Things like minimizing caffeine and alcohol in the evenings or the afternoons before you go to bed, because they can interrupt your sleep. Things like perhaps learning some relaxation strategies to help you manage the feelings that come up when you're being bothered by the noise might be helpful, another internal strategy. And I think whatever you decide to do, good luck with it. It's a difficult problem. I hope you find some solutions that help you. What is the best way to deal with dietary non-compliance in children and teenagers with PKU? So that's a really big question, and an important thing to say is that I work with adults, so you should discuss that issue with your paediatric team, who will probably have some different ideas and some extra ideas to me. I think it's understandable to want the best for your children and to worry about their health and to worry about looking after their health the best that you can. And it's a challenging time, because part of growing up and developing is experimenting with more independence and developing your own identity. And at that time, being like your peers can become really, really important. So you're definitely not alone in those worries. I would think that that's an experience that a lot of families share. Some general things I think can be helpful are encouraging your children to be able to talk openly with you. And there are some good books that have been written about this that might help you. There's one called How to Talk So Kids Will Listen and Listen So Kids Will Talk. And then there's also, by the same author, How to Talk So Teens Will Listen and Listen So Teens Will Talk, with more ideas about that. Might also be helpful to give your children a sense of choice and control where they can have it, as they perhaps don't have a lot of choice about their diet. There may be some other areas where you can let them have freedom and choices, and it might be worth spending some time thinking about what you want those to be. I'm interested in whether research has found a relationship between blood phenylalanine concentrations and organisational skills in adults with PKU. For example, does a Phe level of 300 enable better organisational function than 700? So there is evidence that phenylalanine levels for children are related to their executive functions, which are higher level complicated thinking skills that are really important for planning, organising and problem solving. The relationship is a bit less clear for adults, and there's all sorts of things that make that relationship a bit more complicated. So I'd advise that you discuss that with your metabolic centre, because although there are some studies that have looked at whether phenylalanine levels for adults are related to those executive functions, studies look at groups of people and every individual is different. So they'll be able to advise you about the most helpful course of action for managing your PKU for you. Okay, we've got some new questions coming in right now. I'm the parent of 2 children with PKU and I struggle with anxiety when it comes to my children, as I'm always worried about their future and how they will deal with things when I'm not around. So I think it's another challenging question, and I think I really feel for people who are having those worries. They're really understandable. I think especially if you are already struggling with anxiety, as most parents have some anxiety about their children's futures anyway, if you're experiencing more anxiety on top of that, that's hard work and it's a lot to deal with. So I think my first thought is about getting some help and support with that, whether it's from your GP or elsewhere. I think it's important to find out what help is available. There may be other things as well that could help support you and the children, for example, from their school, and it's worth checking that out as well, or from their metabolic centre that's looking after them. I'm trying to think if there's anything general I would suggest on top of that. And I think the main messages I usually have come back to treating yourself kindly and taking good care of yourself. And a big part of that is using the help that is available. So have a look at all those places, your GP, the metabolic centre and the school, and see if there is something that could be supporting you. And another new question just come in. I find it hard to eat well in diet, especially when travelling or being out with friends. What's a good way to explain to them the needs of the diet and be more assertive in asking for specific needs in restaurants? It's a really good question. And again, I think you're really not alone in having that experience and finding that difficult. Like I said, our minds are always thinking about what other people are thinking about us. And that's really hard because quite often we can be quite wrong about it. We can be quite surprised if we get the chance to check and find out what somebody really is thinking about us. So that's one thing you could do, is you could ask some trusted friends what they do think and see whether your worries were realistic. I've spoken a bit about assertiveness, and so I'd reiterate some of those ideas about making it clear what it is that you need and why, at the same time taking into account what other people need, whether those people are your friends or the people that work in a restaurant. And spending a bit of time doing some advanced planning can be really helpful. So actually sitting down and planning in advance what you want to say and how. You could even practice it on someone. It sounds a bit weird. Quite often when I see people for psychological therapy, we spend some time practicing things like that in the room, just to really help you to feel prepared and feel confident to do it. Probably easier to start with the friends you're closest to, who you trust the most, because I guess it will feel the least challenging and you can work up to some of those more difficult situations to being assertive then. And the next question we have, I find staying on my diet incredibly overwhelming, and when I'm strict, I'm all of a sudden aware of how much I can't eat, and it really gets to me. Is there any way to help not being so overwhelmed by these emotions of helplessness and frustration? So it's another really good question. And again, I think they're understandable feelings to feel a bit frustrated, like you're being denied lots of things, and a bit fed up. And I think, I know I keep saying it, but it is a good thing to ask your metabolic centre when you have an appointment or you're talking to the dietitians, and see what they say. I would say they're thoughts that I hear quite often from people. When it comes to not being overwhelmed by feelings, those mindfulness skills for some people can be helpful. So it might be worth looking into to see whether it might be helpful for you. There are lots of different places you can get more information about learning mindfulness. So you could ask your GP whether there are any NHS options near to you. There are a lot of very similar 8-week mindfulness courses that run all over the country. I think there's a website called Be Mindful where you can search by postcode to find ones that are running in your area. So that's one way to learn more, by attending one of those 8-week courses. They are quite a big time commitment. Usually it's a 2-hour lesson each week, and then there'll be homework to do each day as well. But it's a way of getting really, really good at those mindfulness skills. Otherwise, ways to find out about it might be trying the app that I mentioned, Headspace, which is a good way of perhaps dipping a toe in and getting a bit of an introduction to see whether it's something that seems helpful to you. Or you could try reading one of the books that comes with a CD of guided mindfulness meditation exercises to start to practice some of them, and see that way whether it's something that feels helpful for you. So there's a whole range of different options for learning about mindfulness, but it can be something that helps feelings to feel a bit less overwhelming and more manageable. Or it might be that you do want to talk to someone else about them, and then probably what I mentioned, searching online, can I get free therapy or counselling, can give you some more information about the options where you live. Next question we have is, what is CBT? What can it help with? So CBT stands for Cognitive Behavioural Therapy. It's a way of thinking about and understanding the relationship between your thoughts, your emotions and feelings, and the things that you do. So if you were working with a CBT therapist, some of the things you might be likely to do are to practice tuning into those automatic thoughts that I talked about, and checking whether they are really realistic and balanced, and checking whether they're helpful for you. It might mean looking at some alternative kind of coping strategies to try when you're faced with difficult feelings. And CBT is probably most often used to help people who are having mild to moderate problems with anxiety or feeling low in mood, although it does get used for a whole range of other things, like perhaps finding ways of living with and dealing with physical health problems. It's a model, is what the word I'm looking for. It's a way of understanding things, but it's also a type of therapy that quite often is available from the NHS. There are services all over the country with teams of CBT therapists, and quite often they accept self-referrals. So quite often you can search for the service in your area and perhaps contact them yourself by phoning them up or filling in an online form. And that way they can give you some more information about their service and exactly what they do. And they might ask you some questions about you and any difficulties you're having, to learn a bit more about what's going on for you. So that way you might be able to find out whether CBT is something that might be helpful for you. You could also ask your GP. You could also ask your metabolic centre whether they know anything about where you could access CBT or whether it might be helpful for you. I want to try to do more exercise and get fitter, but every time I start exercising regularly, it seems to fizzle out. What could help me to keep it up? So I think that for this question, I'd come back to some of the ideas from the presentation about setting goals that are achievable and realistic and specific. It's much easier to keep up goals around exercise probably if you make them part of your routine, because it is really difficult to change our habits. So if you're exercising and it's part of your day because you're doing it on the way to work or the way home from work, that can make it much easier to stick to. Involving other people and getting help from them is useful too. So Exercising with friends or with family, somebody who can help you to stay motivated, is a good idea. I think that perhaps another idea that might be useful is the idea of acting in spite of how you feel, not because of how you feel. So although you might really not feel at that moment like going outside to go for a run or do some other kind of exercise, but you know that it's something that will perhaps help to improve your mood, help take you towards your fitness goal, perhaps that's a time to be mindful of that feeling and not wanting to do it, and instead, if it's appropriate, to do it anyway, despite the way that you're feeling, and then see how you feel afterwards. I've heard about mindful eating. Will that help me? So mindful eating exercises are exercises in applying mindfulness skills while you're eating food. So an example would be trying to eat food and at the same time to really notice and pay attention to how it looks, how it smells, how it tastes, to the feelings and thoughts it brings up in you, you know, perhaps that it makes you want to eat the food, or perhaps that it makes you think of something else. And for some people, it can help them to, I guess, enjoy food and appreciate it more. For some people, it can help them to make more conscious choices about what they eat and when. There is a whole book about mindful eating that's been written by Jan Chosen Bays, and she writes about developing mindful awareness of different types of hunger. So, for example, when we feel hungry because of how something looks, or when we feel hungry because of how something smells really delicious, or because it tastes interesting. So she talks about eye hunger and mouth hunger and nose hunger, which sound a bit odd. They make sense when you read about it. And she also writes about kind of hunger because of how we feel emotionally, or how eating something will make us feel emotionally. And also feeling hungry because our body needs energy. So, so she has also a CD that comes with the book with a whole load of exercises for developing your awareness of those different types of hunger, of why you might feel like eating something at a particular time, and about making conscious choices about what to eat and when and how. And there's also an exercise that's around a lot. You can find it on that Frantic World website or in the book, where you might just eat one small piece of food, like a raisin or a piece of chocolate, mindfully, whilst really carefully paying attention to the whole experience. So that would be a good introduction if you wanted to get an idea of what mindful eating is. And we have another question that's just arrived. My older child who has PKU is 12 but doesn't take his diet seriously. How can I explain to him how it's for his own benefit without sounding harsh or strict? I think that's another really tricky question, and you know, connects to the other question about supporting children to manage a PKU diet. So I would say that probably at age 12, when somebody is just starting to you know, develop their sense of self and independence, I'm not surprised that that's a difficulty. It probably is something that your metabolic centre has encountered before. So you know, please do talk to them and see if they have any ideas about supporting your child. It is a challenging time. You know, I think you're obviously a parent who's quite reflective, who's thinking carefully about how you sound to your child and how that makes them feel. So I'll mention that book I mentioned before again, about developing skills in talking openly with children and encouraging children to talk openly with you. They're called How to Talk So Kids Will Listen, and Listen So Kids Will Talk, and How to Talk So Teens Will Listen, and Listen So Teens Will Talk. You might want to have a look at the teen one, as your child's approaching their teen years now. And perhaps that will give you some ideas about different ways to open up those conversations about managing the diet. Some other questions. Where can I find out more about counselling or therapy services nearest to me? So I already mentioned a little bit about accessing counselling or psychological therapy. So if you wanted to find out more about the service, I would recommend going online and searching for "Can I get free therapy or counselling?" You can find out more about the services that way. You could also discuss it with your GP, who will already know about the services nearest to you and what they offer. Or, like I said, lots of them accept self-referrals, so you could call them up directly and ask them for some information. If you did decide that you wanted to try a referral to one of those services, whether you make the referral yourself or whether you ask your GP or another healthcare professional to make the referral for you, what normally happens is that first of all they telephone you and they ask you a whole lot of questions on the telephone about what's going on for you to get a sense of what difficulties you're having in particular. And then they might perhaps talk with you about what your goals are to try to sort of negotiate what things they can help you with. And so that you know what you can expect from them. And then you might agree a plan, and that might be that they give you some resources or direct you to some things to go away and work through and look at. It might be coming back for some appointments with a psychological therapist, and usually that's sort of weekly for a certain number of weeks, say for example 6 weeks or 8 weeks or 12 weeks. So that's probably what would happen if you were to try to contact them. I can't say for sure what every service in the country is like, but that's typically kind of how they work. So if you did get in contact with them, or if you did even go along for an assessment, a first meeting, you wouldn't be tied in. If you went there and thought this isn't for me, you wouldn't have to go for 6 weeks, but it is a good way of finding out more about what they can offer. And another question here, do the treatments for anxiety and depression that work for people without PKU work for people who have PKU as well? I would say I've met lots of people with PKU who have experienced difficulties with anxiety or with feeling low. And it definitely seemed to me that the same things can be helpful for people with and without PKU. So in my experience, I've been working with people with PKU for just over a year now, but in the past I've also worked with people with a whole range of other long-term conditions, including things like obesity and cystic fibrosis and neurological problems like stroke or multiple sclerosis. And it seems that options like psychological therapy can be useful in a range of those situations. And the range of difficulties with mood or with anxiety that people might be experiencing in the context of all different kinds of physical health problems. There are some guidelines on helping people with depression who have a physical health condition, and in those guidelines mention options like psychological therapy, for example, cognitive behaviour therapy, and also things like medications, which you can ask for more information from your doctors, your specialist doctors, or from your GP. So those are the main options, so kind of talking therapies or medications. And there are lots of different types of talking therapy, and there are lots of different types of medication. So if you try one and it doesn't seem to really work for you, it's worth keeping communication with healthcare professionals open and exploring all of the options that are available. Where can I learn how to do mindfulness? So I've spoken already about a few options for learning about mindfulness. There's a big range of apps, websites, books, all sorts of things. So I mentioned the 8-week programs, which are called either mindfulness-based stress reduction or mindfulness-based cognitive therapy. They have really similar content usually, and they involve going along weekly, completing a course, learning and really practicing those skills, having an opportunity to practice them in a room with a teacher and with other people, which is really useful. There might also be things like clubs or workshops close to you. They might be sort of one-offs, or they might be a mindfulness meditation group that meets regularly, where you could go again to get some support and advice from other people and practice with them. Any other questions? Will going back on diet help with depression or anxiety? So I think it's really important to treat everybody as an individual. Psychologists use an approach called formulation to build an understanding of why somebody is experiencing difficulties like feeling low in mood or feeling anxious, that combines medical factors with other things like the events that have happened in their life, their relationships, their environment, their own kind of strengths and coping strategies. So there is some evidence to suggest that PKU diet can improve mood. And where I work, I assess people who are going back onto a PKU diet before and afterwards to help look at the effects of going back on diet for them. Some people have found out that going back on diet improved their mood, some of those people that I've assessed. Some have found that it didn't. So I think that's why I think it's really important to look at each person as an individual. So I would suggest talking that through with your PKU centre to work out what's the best option for you personally. Okay, do we have any other questions? All right, I think that's all your questions. So I want to say a massive thank you to the team at Nutricia for organising this today. I was really glad to be able to share some psychology ideas with you. Really excited to be able to hopefully spread them a bit wider. I want to say thank you as well for signing in, for your attention and for your questions. You know, some really insightful, thoughtful questions. So I really appreciate that. Thank you very much for signing in.